Well, good evening, folks. My name is Ben. I'm the host. I'm really excited to introduce Lauri Leadley tonight. She has a great story. She's going to talk about her sleep apnea journey and share some really neat things with us. If you guys want to ask her a question, just hover your mouse over the bottom of the screen where you see the Q&A icon, type your question, and it goes directly to Lauri. So, Lauri, we can't wait to hear your story. Welcome to the call.
Good evening. Thank you, Ben. I appreciate all of you and your interest in registering for tonight's webinar to hear about my personal story. You know, as a 6-week-old baby, I had pneumonia and was in and out of the hospital pretty much all of my pediatric life. I had a tonsillectomy at age 4. I was diagnosed with juvenile rheumatoid arthritis at age 8. And all the medical care that I received during all of these events led me to want to give back the way that I was given to during these hard times as a child. So I became a respiratory therapist. And along my respiratory therapy professional journey, I was fascinated with the physiology of sleep and breathing. Maybe it was because my dad snored like a herd of elephants. We could hear him from, on the second floor, outside the window, through the walls. It was incredibly, and he did have severe sleep apnea. My very first cancer came at 26 years old when I was pregnant. I continued to have recurring pneumonias, had to have a lot of chemo. And by age 30, I actually realized that I had obstructive sleep apnea. So this is when the tongue and soft palate relax during sleep, blocking airflow. It's characterized by snoring. I myself had very loud snoring. Over 20 million Americans actually suffer from moderate to severe obstructive sleep apnea, and mine is severe. So this is a sleep study that we see in your screen. So this is an apnea, and what we see is when you stop breathing, your blood oxygen level drops significantly. So this first little episode, this patient held their breath for 47 seconds. Their oxygen level dropped to 84%. They take a breath and then they stop breathing again and they drop all the way to 74%. So imagine holding your breath for 47 or 86 seconds while you're awake. So it's really, really detrimental on your sleep. And there's severe consequences to untreated sleep apnea. You have fatigue, diminished productivity. I struggled with this for years, but it was always attributed to my RA. You're snoring. My bed partner has suffered from my snoring for years. In fact, my new little daughter-in-law at the time, we shared a hotel room when they were just married, and we woke up to her sleeping in the bathtub because my snoring was so bad. And she said to Connor, my son, "Never again are we sharing a hotel room with your parents." You're an accident risk, a community risk to everyone out there driving. I had 4 car accidents one year, maybe because I was tired. Looking back, I think it might have been. Your own heart and brain health. And then I personally truly believe that, my 2 cancers, I was diagnosed in 2015 with breast cancer. I believe that they are from my untreated sleep apnea. There's a saying out there that cancer loves sugar but hates sleep. And I think the fact that my sleep health has been so diminished for all these years, it attributed to my sleep apnea, or cancer, attributed to my cancer. So when I first got diagnosed with my breast cancer, I realized I need to take this seriously. And my CPAP was kind of, not used, and I started to really try to wear it. You get great results when you use it regularly, but like me, I just couldn't acclimate it. I kept getting pneumonias. My chin would drop to my chest when I was on my back in REM, and the CPAP would blow, and it was almost more disturbing than the snoring. I tried an oral appliance when I was first diagnosed. That worked great when I had mild sleep apnea. But over time, it started to bother my teeth. And eventually, once my sleep apnea got to be severe, it didn't work anymore. There's anatomy altering surgeries that you can have done. I had my tonsils out when I was 4. That probably got me through a lot of my pediatric years. But when I went to the surgeon to find out what my options were, there was no other anatomy altering surgery that I could have. But he did say that I was a perfect candidate for Inspire. So Inspire is a small pacemaker-like device that's implanted in the chest. You get a remote and you press a button to go to sleep and you press a button to turn it off. So here we see a patient who has Inspire getting ready to go to bed. He grabs his remote, turns it on, and as he falls asleep, it senses your breathing, stimulating the back of the airway, the tongue and the soft palate, pushing it out of the way, opening up the back of the airway, eliminating most snoring and sleep apnea. So it's a safe outpatient procedure. It's inserted through 3 small incisions. I spent half a day in the surgery center. I had a very fast recovery. I was home talking on the phone the night of. I had prescription anti-inflammatories. I did not take any pain medication. I took over-the-counter pain medicine on like the 2nd or 3rd day. I was able to return to all my non-strenuous activities with just in a few days, and then back to working out, which I love to do, strength training, Pilates and yoga at 14 days. I was allowed to do that. Inspire has an 11-year battery life, and one of my main concerns and why I was so skeptical about getting it for so many years is that I needed MRIs being a breast cancer patient, and I quickly learned that there's a lot of other imaging options out there besides. Because when you have Inspire, MRIs can only be done on the head, neck, and extremities. So here we have a scope looking down without stimulation. This is what your airway looks like when it's occluding. You can see there the base of the tongue dropping back. And the palate, you can see the bubbles. That's what apnea looks like looking down. And then with mild stimulation, you can see here that the base of the tongue is moving out of the way. So is the soft palate. It actually remodels your airway over time. Inspire is meant to be worn all night, every night. And sometimes it takes a little time for you to get used to it and for it to actually remodel that airway. So after you get your surgery, you're going to come back to the sleep center where we turn the Inspire therapy on for the first time. It's 30 days. I was implanted in February, so I was activated in March. And this is where we establish comfortable, effective settings. They teach you how to use your remote. We get this great video book. So I refer to mine a lot because when you first learn the remote, you're like, okay, am I going to remember this? You just go back to the book, refer to it, look up what you want, and then you get to go home and start using your therapy. So Inspire does have some pretty strict indications. You need to have moderate to severe obstructive sleep apnea, unable to get consistent benefit from CPAP. You cannot be significantly overweight, but don't let that deter you. You need to be able to pass an airway exam. You have to be 18 years or older. And most insurances here, we have a 95% local approval rate in Arizona. If you haven't had a recent sleep study within the last 2 years, you're going to need a new one. This is Joanne. Joanne was one of the reasons why I got Inspire. She's about the same age as I am. She also had a lot of other chronic illnesses and just really struggled with her sleep. And she felt like a lot of the things that were happening with her health were because her sleep apnea was untreated. So you can see here, this is her sleep study. Before she had Inspire, she had an apnea-hypopnea index. This is where we measure your average hypopnea apnea index throughout the night per hour. She had almost 22 events per hour. That's moderate sleep apnea. So once she was implanted, we activated her 30 days later. She went home, used her remote, got used to it for 90 days. She came back to the sleep center where we did her fine-tuned sleep study, and her index was all the way down to 1.97. This is a cure. Any apnea-hypopnea index lower than 5, we consider a cure. So here is my sleep study. So I hadn't had a recent sleep study, so I went back in at the very beginning of February once I finally decided, okay, I'm going to get Inspire because I want to get healthy. My index, surprisingly to all the sleep doctors at Valley Sleep Center, was 63.78, like almost 64 events per hour. This is severe. And so I got implanted within just a couple of weeks. got activated 30 days later. I've been working with my device for over 90 days because I had some trouble getting used to it, but I finally found the perfect settings, and now my post-Inspire AHI is only 1.5, and I feel fantastic. I haven't been sick in over 9 months, and that never happens. I always get some sort of cold or bronchial or pneumonia, and I really believe that finally, because I've treated my sleep apnea, I'm healthy. So if you're struggling with CPAP, I really encourage you first to meet with Andrew Neighbors. He's our respiratory therapist. He is excellent at helping you troubleshoot what your issues are. There's thousands of different masks. So if you're not ready to completely give up on CPAP, it is the primary choice of treatment. Please make sure you book a CPAP follow-up with Andrew. And then if you're struggling with your weight, if you feel like, oh, I'm not a candidate because my BMI is too high, we have a great new program called Sleep to Slender. It's ran by our nurse practitioners. It is covered by your insurance if you have obstructive sleep apnea. And we will help you shed the pounds that you need to do so that you can be qualified for Inspire. So, want to know more? Schedule an Inspire consult. If you're on the call right now and you want us to call you, just click that raise your hand button and I'll make sure that a scheduler calls you tonight. If you want to call us, there's our phone number, 480-830-3900. Or if you're like me, I like to schedule my own appointment, go to valleysleepcenter.com, click on schedule an appointment. You'll go to this box page, which is schedule an appointment with an email on the right, or schedule an appointment online on the left. If you click on the left, you'll get this screen. And this is where you schedule an Inspire consult. And we are doing these on telemedicine as well. So if you're an established patient, really easy, go in there, telehealth, regular. And then if, let's say that you're new to us, you don't want to deal with insurance, we have an amazing cash pay package called the premium package, and for $500. So even if you're watching from another state, right now you can cross state lines and do a televisit with one of our board certified sleep physicians or our nurse practitioners who specialize in sleep. We will mail you a watch pat, which is a disposable home sleep test. You just need a smartphone. You'll get a virtual follow-up, all that for $500. You never have to leave your home. So when you do log on to valleysleepcenter.com, the first box that comes up is Ask a Sleep Coach. I'm your sleep coach. All of those questions come directly to my email. I answer them within an hour. I want you guys to know that I'm here for you, and I know what it's like to struggle with health issues. I want to be able to answer any questions now, or if you think of something later, feel free to just send me a message here and I can get right back to you. But for now, I think we can just open it up to questions. And again, if you want to speak to Joanne or myself, is Joanne on the call?
Lauri, she's not on the call. So folks,
Okay.
if you do have questions, please type them now and Lauri will answer them. They go to her directly. Lauri, it seems like we get a lot of common questions about, for you, what was recovery like? And then after the recovery, talk about the stimulation. Did you feel it, etc.?
So I had an incision in my neck and I had some trouble with the tape because I'm fair skinned and I had a lot of itching. But that was really my only complaint. And I think I said I talked a lot on the night of my surgery. And so I was more swollen. So I would really recommend like not talking. But anesthesia makes me chatty. So just take it easy on the night of your surgery. But it's really pretty simple. My tongue and my mouth was a little bit sore because they do a lot of testing the device while you're asleep. And my mouth is sensitive to because of all the chemo I've had. I was really struggling with that. But as far as the stimulation goes, it really reminds me of a TENS unit, if you've ever used, or there's kind of like a small vibration in the back of your throat, which honestly, it's a little soothing if you happen to, so you get a delay on your remote. So you can pick what you want, 30 minutes, 15 minutes, 40 minutes, an hour, whatever time you need to fall asleep, because you want it to kick on when you're good and asleep. So it shouldn't wake you up. But if it does wake you up, it has a pause button. You just pause it, go back to sleep. I find the stimulation now that I've been doing this since March more kind of relaxing because it's a little bit vibrating. and like a hum. At first, it bothered me, but I just went to the sleep center, and Dr. Mohan just kind of adjusted it a little bit for me, and that really made a difference. It is customizable to each of our airways, which is so interesting about Inspire. And I talked about that remodeling the airway. And I really was struggling because I wanted my snoring to go away completely, which we don't guarantee that it gets rid of snoring completely. But I mean, I snored like my dad, like a herd of elephants. So it was really difficult for me to totally eliminate my snoring. But over time, all of a sudden my husband was like, "You're not snoring anymore." And I really believe it has to do with that remodeling the airway. And so I was able to go to the sleep center for my follow-up appointments like I should, and have them change the settings a little bit for me until I got used to it. I really love that it's so customizable to each patient's airway.
Lauri, somebody wants to know, they said they're already a patient, but they were told the Valley Sleep Center does not have physicians. Has that changed? Can you speak to that?
Oh, we definitely have physicians. We have, I think, 6 board-certified sleep physicians and 5 nurse practitioners that specialize in sleep.
Talk about your locations for folks out there.
Oh, you know what I'm thinking? They might be wondering if we have actual surgeons at Valley Sleep Center. We don't have actual implanting surgeons, but we have 7 different surgeons in the Valley that we can send you to that we work closely with. So maybe that is where the miscommunication is, but we definitely have board certified sleep physicians. We have 6 locations here in the Phoenix area. We're going to be expanding to Tucson soon, so we'll have 7 in Arizona. So we're in Mesa, Chandler, Phoenix, I can think of Goodyear, Glendale, Arrowhead area, and Scottsdale.
Someone wants to know specifically about BMI, and that's maybe a physician question, but can you talk to the BMI qualifications?
So body mass index is usually, depending on your insurance, I think it's 35, or some have 32. So if you're riding around that area, please book a sleep to slender consult and let us help you.
So folks, thank you for asking your questions. Continue if you want to raise your hand or type in your number. Lauri will have her team reach out to you guys tonight.
Yes. I'm unable to see all the questions. So did we get everybody's question answered? Please don't be afraid to reach out to me. I can even call you if you want. If you send me an email on that Ask a Sleep Coach box, I'd be happy to talk to you over the phone and share more with you. You know, it is a really hard thing. I had the best respiratory therapist at my fingertips to help me work through my issues, but the pneumonia was really kind of the thing that I had 2 years ago. I had a pretty bad pneumonia and they thought it was cancer. And that's really where I realized I don't need an MRI because they put me in the PET scanner and it was just pneumonia and I was able to get rid of it. But I just felt like I wasn't the best at cleaning my CPAP, which, you know, that's another really important thing. Andrew can help you with that. We sell So Cleans. It's super important, especially right now, that you do keep your equipment clean. I just think with my immune system being so run down, I wasn't able to fight the slightest little thing. And I'm happy to say, like I said, like almost 10 months, I haven't had any pneumonia, any colds. I've been sick at all, which is really, really a miracle for me. I've been, you know, in and out of the doctor's office and antibiotics and all that my whole life. So.
Lauri, we're so happy for you. It's a wonderful story for folks out there who want to invite a family member or friend. When will you be doing future talks and how do they sign up?
So next Wednesday at 5:30. So the first 3 Wednesdays, Christmas and New Year's Wednesdays, we're going to take off those 2 weeks. But you can go to valleysleepcenter.com/events to register. And please bring somebody. I'm going to keep telling my story for the next 2 because I know there's a lot of people out there that are really struggling. And you know, if you're a woman over past menopausal age and you're struggling with fatigue, and, you know, ask your doctor if you could get a sleep study, because I don't fit the sleep apnea prototype. And it was shocking to even our own in-house sleep professionals that I had as severe sleep apnea as I did. But it's all it's hereditary and anatomical. And I think I was thrown into menopause with breast cancer. And so all that attributed to that, my collapsing airway. But I love how stimulating the muscles and the tissues has made them stronger. And I'm, all that opening up and the snoring is completely gone now.
If somebody has a question for the sleep coach over the holidays, will the sleep coach be available?
I sure will. The only reason I'm not available is if I'm asleep. Yeah.
Well, Lauri, thank you so much for your time tonight. The folks out there, Lauri is really doing this to help others, and you'll find that when you go to Valley Sleep. So if you have friends or family, next Wednesday, I think Lauri will be doing this. Yeah. And if you guys have any final questions before we log off, please ask.
I look forward to helping you guys. Thank you so much.
All right, folks, everybody have a nice evening out there. Lauri, thank you again. We'll see you next week.